Wabarakatuh. Actually, I just want to introduce all of you to the group as well as what we can do on what you can expect. Usually, you will see a lot of people sharing some questions, MCQs, books. Okay. My point of view is that you can share anything positive, any question, any case discussion, you have any query, any point of care challenges, like you are dealing a case and you want to discuss any query. Okay, so you can just drop over here. This is one thing. Then usually I share some topics. Okay, and right now, like, I have shared this playlist because I just used to discuss questions and discuss various topics regularly and post them on YouTube channel. Okay, but it's a non-monetized channel and it's for the benefit and betterment of anesthesia. So if you will click here, you will find all the discussions being done on blood topic. Okay, so here you can see some of the links which I have shared just now, related to all review articles, anesthesia tutorials on these topics. Okay, anemia, blood physiology and diseases. I can show it to you, but I just wanted to just have a look. And I just share some question. Okay, so you can see here, like, for example, this is anemia question. Okay, so you can just instead of just reading from any source blindly and you don't know what you want. Okay, so the advantage of knowing what are the goals and what are the objectives from certain topic, it becomes easier for you. Okay, so I have just tried to write down what topics or what goals you should be knowing from a certain topic. Okay, and write everything you can find in the Google Drive link. Okay, I will show it to you. So there is a Google Drive link over here. Okay, so you can find over here these articles. These are topic wise arranged and these are year wise. Okay, in year wise articles you can find all the sources, and I suggest you just have a look. You will find almost all the topics. You will find maybe more than one articles on the same topic. You can find the best out of it, open it, have a look. You can compare with them, and maybe you can follow the latest of them. Okay, updates in anesthesia, BG education, anesthesia tutorial of the week, and it's a very good academic source, this anesthesia ICU journal. Okay, then here you will find some books, all the books, different, you name anything, and all of them are classifying. You unfortunately, even the people who are in the group for a long time, they don't have time to have a look on these links, and it's really disheartening for me. Okay, but actually you can just have a look here. You will find basics, clinical review, ICU books, MCQs, a variety of topics. Okay, like MCQs of basic sciences, clinical sciences, regional. Okay, ICU. You will find a lot of pools over here. Okay, then even for other topics, OSCE books, physics equipment books, you can find over here. Here I have classify or you can say do post-mortem of a number of topics. They are not all of them, but majority of them I have just chalk out, and this is just a learning objective. You can say whenever you are reading from any source, if you just have a look, so this will give you a guide that when you are reading the topic, you should be trying to find out the answers to these questions. Okay, so a number of topics are here. Even the people who don't have SAQs pattern, still you can have here, there are solved SAQs, and actually the topics are the same, maybe whether they are being asked in the oral part or whether they make MCQs out of it, the knowledge is the same. Okay, so you will find a number of topics here. Okay, so this is a very good source for you. Then for people going for oral part, a lot of scenarios I have just chalk it out. There are scenarios for EDA exam, FRCA exam, basic sciences exam. You will find so many things. You just have to open and have a look. But unfortunately, people are so busy, they don't have even time to have a look. I spent so much time creating these links, and unfortunately people are so busy and you people are so lazy, you don't want to even have a look. So if you want to utilize it, you have to open it and have a look. Okay, so this is another thing. Then for some important points, how you should be target any case. So this is a very good document which can help you a lot. And in this you can just have a look that how you should be target any case, because any case you have the patient identity. Patient may be pregnant, adult, elderly, smoker, diabetic, hypertensive, anemic. These are the common patient groups. Okay, obese. And then there will be one disease under consideration. That disease may be sickle cell disease, von Willebrand disease, porphyria, asthma, COPD, diabetes, like any disease, and the end there will be one surgery. So how you need to integrate it. Okay, so if you can modify these things, but with reference to surgery, you should be knowing it should be whether it is urgent, what are the surgical risk, what position required, what duration required, what NCN. So you can have a look, whatever case you are doing. If you spend few minutes in having a look, print it out, and just try to identify the answers rather than reading any topic blindly. Okay, so this will give you a very good idea. Okay, similarly, this is some planning with reference to, you can say, how to take the history, how to do the examination, how to make certain risk factors. Okay, so there are some scoring systems you should be knowing. So I have chalked down all of them. So if you have a look at here, it will help you a lot. So you can have a look on these documents, which will be there right in the link. Okay, and these are some FRCA mind maps. These are also very important. They can help you a lot. So that's it. So topic under consideration was anemia. So you should be knowing what are the causes of anemia, as I write here the question right here. And this was the question that I just put through in the morning, that you have an anemic patient. Why it is important? So it's mainly related to the myocardial oxygen demand supply ratio, because hemoglobin is the carrier which takes the blood the oxygen throughout the body. Okay, so if you have low hemoglobin, the main oxygen content is with the oxygen carried by the hemoglobin. The dissolved oxygen is very less. So you should be knowing how to calculate, what should be the formula about it. Then you should be knowing what are the causes according to the age, sex, patient group. There is reason like anemia of chronic disease. There may be some loss. There may be some bone marrow suppression, patient taking any chemotherapeutic agent. So you should be looking at the cause of anemia rather than just the number. Okay, and maybe sometimes some numbers are good for some patient. Like example is CRF patient. So chronic kidney disease patient, they always have low hemoglobin, so you don't want, and they are compensated. So usually these patients are compensated. Okay, so you should be looking at the compensation. What are the compensatory mechanism to anemia? Okay, so similarly, how will you manage? So if you have an elective case, either you will have, first of all, you will refer the patient to hematology, and they will try to know they will do the peripheral blood film. They will do all the orifices from where the blood is being lost. Maybe it is through the vomiting, through the menorrhagia. Okay, maybe it is through hematuria. Okay, so like any of their source. Okay, so you should be knowing how to proceed in this scenario. So this will be your main way how you will be proceeding with the case. You will be evaluating the patient in that way, and then you will decide whether to transfuse blood, whether to give oral iron, whether to give IV iron, whether to give some other things. Okay, so the treatment or management will be according to the urgency, according to the patient group. Okay, and according to how much time you have. So this is how it's important. And maybe the cardiac patient who needs more oxygen will be at risk, and you will be looking at it in a more critical insight than other patient. Okay, so any other further questions, you are all welcome to ask anytime. Thank you.